Did you know that 1 in every 20 people suffer from hypothyroidism? That's 4.6% of the entire population ages 12 and older. According to an entry from Dr. Kevin D. Rowley for the American Family Physician, published August 1st, 2017, quote, approximately 12% of people will develop a thyroid disease throughout their lifetime, end quote. Preserving the integrity of the thyroid and treating it properly is of utmost importance and is the central goal of the physicians who recommend hormone therapy. A standard thyroid stimulating hormone level is between 0.45 and 4.5 microunits per liter, based on findings from a scholarly journal on hypothyroidism written by Anna Saka on February 1st, 2015. Hypothyroidism is determined when TSH levels are greater than 10 microunits per liter. Treatment using hormones is usually greater than 2 years for most patients. Approximately 1.25% of patients with hypothyroidism will die from the disease every year. The thyroid gland's main function in the body is to maintain all levels of metabolic rates, contribute to growth and development, and maintain balanced regulation of bodily functions by releasing a consistent and constant amount of TSH into the bloodstream. Having hypothyroidism is having an underactive thyroid. This means that the thyroid gland is failing to produce enough thyroid-stimulating hormone for the body. When this happens, there is a disruption in heart rate, body temperature, and metabolic rate. Hypothyroidism is most common in women over 65. As explained in the novel Thyroid Disorders by Gilbert H. Daniels, access on June 16, 2020, quote, the most prevalent symptoms of hypothyroidism include fatigue, cold sensitivity, weight gain, dry, flaky skin, and hair loss, end quote. Hormones lessen the severe effects of an underactive thyroid by working to improve sufficient TSH levels and can actually aid in reversing patients' symptoms. The hormones act as a replacement for TSH in an attempt to maintain adequate levels and achieve homeostasis within the body. The hormone most commonly used to treat hypothyroidism is synthetic levothyroxine, also called levo-T synthoid. Levothyroxine acts as a replacement for TSH and replenishes the body's absent hormone, according to a case report titled Levothyroxine Primary Adrenal Insufficiency, published by Reactions Weekly in April of 2016. Patients will take their hormone replacement therapy orally at the same time every day. This hormone is also used to treat thyroid cancer as well as an enlarged thyroid gland. Some of the symptoms patients may experience while taking levo-T synthoid are hair loss, sweating, fatigue, mood and mental changes, headache, and bone pain. This medication should not be taken with beta blockers or blood thinners such as warfarin or digoxin. Thyroid hormone resistance, or THR, can be classified as either a generalized resistance or a centralized resistance. With THR, the body's tissues do not respond to the hormone most commonly used to treat hypothyroidism. Hormone resistance is rare and can happen when the receptor that the thyroid-stimulating hormone reacts with is abnormal, resulting in a failed synapse, and the hormones are unable to act correctly on the cells on the other tissues. The treatment for THR, or thyroid hormone resistance, is a drug called Triac. Triac effectively mimics TSH in the liver and the pituitary gland. According to an article from the American Thyroid Association written by Sucharitha Kankanala, published on March 11, 2020, states that 60%, quote, 60% of people with thyroid disease go completely undiagnosed, end quote. The most common outcomes of thyroid disease going untreated are extensive fatigue, memory lapses, thinning hair, loss of the hair follicle, as well as sleep disturbances. Most patients do not flag these symptoms as abnormal due to their similarity to normal signs of aging. If you are diagnosed by a professional with a thyroid disease, your hormone levels should be checked annually. Now that the effects of hypothyroidism are apparent and have been thoroughly explained, I hope that my audience can fully grasp what hypothyroidism entails, how to treat it, and how to treat someone resistant to routine treatment, as well as demonstrate a clear understanding of signs and symptoms to be aware of. Hypothyroidism is a challenging disease that 1 in every 20 people in the United States suffer from. Because there is no direct cure for hypothyroidism, we must solely rely on the hormone therapy method to banish symptoms and assist in reversing them. Hormones can have a multitude of side effects, but have been proven to be the single most effective way to treat hypothyroidism and restore the lives of patients who struggle with it. The information in this speech was researched on the following 5 Saddleback database resources: Lyell-Shocker Hypothyroidism, published in the Lancet, volume 390, number 10101 in 2017. Gilbert H. Daniels and Colin M. Dayan, Thyroid Disorders, published by Health Press in 2006. Levothyroxine, the Primary Adrenal Gland Insufficiency, a case report, published by Reactions Weekly, volume 1607, number 1, in 2016. Sucharitha Kankanala, MD, Why You Could Have Thyroidism Disease and Not Know It for Virtua Health System and South Jersey Healthcare, published March 11, 2020. And Anna M. Saka, Hypothyroidism for Canadian Medical Association, published in March 2017.